Thank you, everybody who has joined us so far. We'll go ahead and kick it off today. Happy Friday. My name is Devin Desjardins, and I am Director of Marketing and Storytelling for United Way of the Greater Triangle. We're so pleased to spend some time with you guys today to talk about the last year of the pandemic and the incredible ways that the Triangle has supported folks in need, but also to take a look forward at what's happening next. How do we recover and stabilize? A few housekeeping items. We will have a Q&A portion at the end. As we're going, please feel free to, like two people have already started to have conversations in the chat, to chime in, to respond. Like, this is really a community-driven conversation, and we welcome all of it. If you have any questions that come up, there's a Q&A button at the bottom. Click that button and just drop your question into there. We'll be monitoring that on the back end. And then once the Q&A portion is ready to start, we'll go based on the first question asked to get through as many as we can before time's up. So now I'd like to introduce Eric Buchan, who is our president, United Way's president and CEO, to kick us off and introduce everybody else.
Thanks, Devin. And thanks to everybody for joining today on a Friday. It's a beautiful Friday out there, a little chilly. So I think it's timely that we're having this about coming out of the pandemic and being a year in the pandemic. I actually got my second shot of category 4 and got my second shot done on Wednesday morning. And I was telling the panelists and Devin that I about 4:30 on Wednesday, I started. I was laid out yesterday, and I'm starting to feel a little better. So glad to be among the living, and so important that we go out there and get our vaccines so that we can come out of this pandemic together. We've got great stories to tell and some really great folks to tell it. So I'm not going to spend a heck of a lot of time here introducing things. This in dollars and cents as clear as can. As Devin mentioned, we want to respond, stabilize, and recover from this pandemic. And what that means in dollars and cents is that we have put over the course, beginning when the pandemic struck with our Rapid Response Fund, our community impact and community investments, we have put, and then as we talk about Ride United, which Cheryl and others will talk about, and as we talk about coming out of this pandemic stronger than ever, we will have put upwards of $15 million into this community. And when I say we, I do not mean United Way of the Greater Triangle. I mean this community. So this is a community here in the Triangle that steps up when we're in crisis. And we stepped up with our hearts and our wallets, and I can't thank you enough. But we are more than just a bank at United Way of the Greater Triangle. This is about money, but it's also about people and time, and it's also about partnerships. Our mission is to eradicate poverty and increase social mobility through the power of partnerships. And we've got some great partners on this call today. So it's my honor to introduce Joan Nelson, a member of our board, a close friend, and so many other places throughout this community. And Joan will be our master of ceremonies to take us through.
Thank you, Eric. And I'm so excited to be here with the team today as we talk about United for Triangle Pandemic Recovery 1 year in. So my first order of business is to introduce our wonderful panel of speakers. First up is Ron Pringle. Ron is president and CEO of the Interfaith Food Shuttle, which has been very critical in combating food insecurity in our region prior to and through the pandemic. Next, we have Cheryl Parquet. Cheryl is the Director of Community Engagement and Marketing Activation at Blue Cross NC, and she's our lead partner in Ride United, the new statewide initiative launched with partnership with the United Way, NCDOT, Lyft, and others. It was launched last month with the goal of increasing transportation access for the underserved communities seeking COVID-19 vaccines. And last but certainly not least, we have Allison Cobb. Allison is the manager, community engagement at United Way of the Greater Triangle, and has been leading all of the United Way's volunteer and emergency distribution efforts throughout the pandemic. Please join me in welcoming our panel. So let's go ahead and get started. We know that COVID-19 did not create challenges around poverty, but it certainly has made those challenges worse. So I think before we even start talking about recovery, we need to ground ourselves in where were we when all of this first started. If we look at some of the statistics, more than 164,000 residents were living in poverty, and 15% of children were experiencing the same. On any given night, 1,400 people were experiencing homelessness, and more than 192,000 individuals had food insecurity every day. So my first question out to the panel is, are there any other challenges we need to share with the audience today? And when did you see COVID start to make those challenges even worse? And that's open to anyone who might want to jump in.
Well, I can certainly start out, if I don't mind here. I think early on in the very beginning, we've started seeing the increase in need as businesses begin to close. In the beginning, when that began to happen and started to happen, it was something that folks thought would be a temporary thing. However, the more we began to learn about COVID and how it was advancing throughout the community and how the long-term effects that it was beginning to have, people started to see themselves in more dire situations as their resources began to dwindle and the need for food began to increase. So that's when we began to see this kind of really ramping up a few months in.
So tacking onto that, Ron, what challenges did you have at the Interfaith Food Shuttle as you tried to deal with these new challenges? Did you have to approach service delivery any differently?
Service deliveries and how we did that, we absolutely had to be unique and creative. Number one, to keep our staff safe. Was our most important part of putting our strategies together is how can we continue to meet this need and ensure that we are doing whatever we can to protect our staff. And so we had to look at different ways of getting food out and modeling after food banks all over the country and trying to glean information and research from the CDC on best practices and coming up with touchless drive-through food distribution models that were proven to be very effective. A big challenge that we saw was with the demand in food, our access to food became a huge challenge for us. So normal food drives and things were down and that food wasn't necessarily coming in. So we found ourselves having to purchase more food, which put us in a position of competing with local grocery retailers. And so the lead time of, it may have taken us a week to get food in from a vendor became 12 to 14 weeks before we were able to get that food in.
Wow, that's certainly a big challenge for your organization. Let me go to Cheryl. Anything that you would add in terms of challenges and how maybe things had to change to adapt to those challenges?
Yeah, one thing I think that we saw, and we need to just really address it, is the racial inequities and disparities that we saw really come to light. That's always been there. All the stats that you gave are truly grounded in there. But, just the way COVID came, North Carolina is 22% African American, but 30% of the cases were from African Americans, 34 of the deaths were African Americans, and then our Hispanic population is less than 10%. We were seeing 44% of confirmed deaths. And so when you think about that from a healthcare standpoint, that's just critical, right? What was happening during that time? But then we started to look at like the educational system, and we know that there's going to be a great divide. Researchers are saying that most students are going to lose about 7 months of education, but we know in Black and Brown families, it's going to be probably 10 months because during this time of COVID, we know that kids were not able to be at home with a parent because their parents were out working. And this goes back to the number of cases in our community, right? This goes back to them not having internet services. And it also goes back to them just not having access to the internet and devices. There's this old saying, and take it for what it's worth, but it says, when America has a cold, the Black community has pneumonia. And I really think this pandemic has really just jumped on and showed us what was really happening around race within our community.
So based on what you've seen in terms of response to some of those inequalities, do you think we're doing enough? Anything that we could be doing better?
I think we are really trying. We have at least identified it, right? Everyone's talking about it. Communities and companies are making statements. And now it's time for the work to happen, right? And so that's going to be a big part as we start to talk about recovery. What does that look like for our kids this summer? What does this look like for our kids going into the school year? And so I think there's a lot of work. I think people are coming together to make sure that we're working around these issues, but we're not going to start to see this until we are back to a normal of getting our kids back into the school system.
Yeah, I think it's absolutely clear that we have to ensure this is a movement, not a moment, to
Right.
address the inequalities that we see. Thank you. How about you, Allison? Anything to add?
As both Cheryl and Ron have mentioned, this whole issue around food access and food insecurity really became exacerbated by the pandemic. What we saw in many of our rural communities with the closing of schools is that many children and families were not able to receive those 1 to 2 guaranteed meals that they were used to throughout the school day. And so that became a huge challenge that we knew immediately that needed to be addressed. And we were able to do that through our rapid response fund and providing those dollars to community folks who were doing the work to ensure that families were receiving food and had access to those things. And as well as Cheryl mentioned, that digital divide, it's still a huge issue in rural communities. Oftentimes we forget about those folks who we take technology for granted, right? Where we have it at our fingertips and we say, oh, well, kids can get access to Wi-Fi at home. Well, there's a bigger issue if there aren't Wi-Fi towers that can support that internet access. And so what we saw from the United Way standpoint is that these issues that already existed in our communities were exacerbated hugely by the pandemic.
So let's build on what you just said. We've seen a lot of challenges. We've seen our nonprofits impacted in terms of having constrained capacity, having more demands placed on them. Let's see if we can make that a little more real. And Ron, let me start with you. Let's talk about some of the constraints you may have felt as we started down this road of recovery with the pandemic.
Yeah, in the very beginning, it was very generous. The community really opened up. There were a lot of organizations, foundations alike, on a national level, state level, and here locally that were coming to the table and saying, hey, how can we help? And in that, they were coming with funding and they were like, hey, here, take this funds and do this with it. And we found that while it was generous, to be a lot more restrictive. We weren't able to be as flexible as the need was driving us to be. And so in some of those cases, we had to, come to the table and say, hey, let's educate you on what we're seeing on the ground. And let's tell you what this is looking like. Because, it's one of the things Cheryl mentioned. One of the things that became more prevalent for us is that food justice and racial justice could not be addressed as separate issues. And the barriers that prevented us from ensuring that we were assisting families and addressing the root cause of hunger had to do with some of the systemic barriers that were in place in diverse communities. So it wasn't a one-size-fits-all model anymore. Our distribution programs could not be a one-size-fits-all. We would order in mass quantities because we were able to drive costs down, which was great for us in the past. However, when you're trying to ensure that what you're doing within a community is really addressing the root causes, the cost is more because you have to tailor your meals to fit that demographic. So we had to, thanks to the rapid response funding and us having that flexibility, we were able to tailor meals in our distributions for specific communities. So we were able to, we were going into a Latino community, we were able to purchase food that we knew would be consumed in that community. If we were going into an African American community, we were able to tailor food, low sodium items, more fresh fruits and vegetables, and then provide the education and the resources as to how do you prepare these meals in a healthier way. And so having that flexibility through the Rapid Response Fund not only gave us the opportunity to do that, but we were able to leverage that and communicate even more to our donors, who soon came on board and was like, hey, use the funds as you see fit.
Very good. Now you talk about the donor response, you talk about the Rapid Response Fund. So let's build on that a bit. So we saw the community stepping up on multiple levels, trying to help our community partners address the needs of our citizens.
Mm-hmm.
That's a very positive thing, and I'm sure it made us all feel good. So Allison, let's expand on that a bit. How did it make you feel to see people wanting to help our communities, and some of the examples of what you saw?
You know, it absolutely made me feel like I was in the right place at the right time. This work is a very much so a passion of mine, that has merged into my profession. And so to me, it's always great to see the community show up and show out, to support our citizens in need. What we also found to be very interesting, especially in communications with our nonprofit partners, through varying channels, is that the helpers were now indeed needing help. And so that for us is something that we took on as an organization and as a team, to identify ways that we could support those who were supporting others in the community, right? That, you know, organizations that were experiencing burnout, or they were experiencing turnover or additional hours due to lack of volunteer support. We really wanted to be intentional around identifying ways that we could support those in community, right? So whether it be through our Rapid Response Fund, or if it's distributing PPE to keep people safe, we knew that those were two areas that we could really be of best support and impact to our community partners who were meeting the need directly, with constituents. And so for us, that's always the driving factor. It's how can we best use our platform to meet the need? And that was definitely the way that we showed up over this year and continue to show up.
Share a bit about the response from our corporate partners and their wanting to help.
Yeah, and listening to Ron, I'm really hoping that Blue Cross didn't keep their money restricted. I know we didn't. But one thing I'll say is that, as corporate funders, we were having conversations, right? Because what we've been at as a corporate funder, a lot of times we talk about this power over and this power with. And so we've been having conversations, and especially at Blue Cross, but we've broken this out to our corporate funders that we also have communications with, because it was important during this time to understand that we can't give an organization money and then give them all of these guidelines. There was an emergency need that was happening, and we needed to be able to have that flexibility, right? And so now I think you're going to see more funders be able to have that flexibility within their giving, because they realize that these organizations are at the front line. You guys know what the community needs. We can't step in and tell you what we want you to do, right? You need to be able to tell us what the community needs. And so this power with, I think, is going to continue to happen from corporate funders. I know at Blue Cross, we really, I think sometimes people think, well, you're a big corporation, so you're still functioning, but our employees had to go home too, right? Like we had a transition. And so, some of the things that we did, we had a cafeteria staff, right? Cafeteria on campus. If no one's on campus, how are these individuals working? How are they staying employed? And so through Durham, us being in Durham, we were able to keep that cafeteria staff open, because we used our cafeteria to actually supply meals and to the community. And so we used our cafeteria staff. So as a corporation, we're also looking to say, how can we repurpose what we're doing inside of our walls to also go out into the community?
So let's build on that, and talk a little bit about Ride United, which is fulfilling such a unique need in the community. Response to that, tell me what you're seeing.
Yeah, so I can say like I am absolutely thrilled about Ride United. You know, we started a coalition around COVID, which was a number of corporate partners, media partners, hospital systems across the state, really working with our state to figure out like what was the need. And transportation kept coming up over and over again once the vaccines came out. And so, reaching out to the United Way, and again, I mean, I'll be completely like full disclosure. United Way reached out to me about one thing, and I reached back out to them about something else. And from some conversations around like, could we get this program going? What would it need? That partnership came about. And not only the partnership with Blue Cross and Ride United, but it was bringing in other partners and sharing that story of, hey, in order for us to get back to a normal, we know that we have to get vaccines. And we know that our communities need transportation, the number one issue, right? So, how do we help our brown and black communities and our over 65 community be able to get that transportation? And I think Ride United was just a perfect opportunity at the right time, meeting the needs of our community. And for every corporate partner that stood up and stepped up, they've taken a stance, but it's going to take so much more. Ron keeps saying this, and I go back to Ron, it's going to take all of us, right? Ride United is one step. The next step is what's next, right? Do we focus on food within our state? Do we focus on the education? Like these partnerships have to continue to develop between private, public, and nonprofits. And I think the United Way has been an amazing partner in working to bring all of this together.
Thank you very much. Allison, let me give you a chance to see if there's anything you want to add to that.
Well, I think, Cheryl said it all there, but I think just to build on her point, transportation is a huge issue. And what we realized is that, again, at the United Way, we have the great position to really be able to facilitate these connections with all of our external stakeholders and partners across the state to really lift up the initiatives to meet the need, right? Particularly around vaccination and vaccination access. And more so, I think it's important to remember that while people will continue to be vaccinated and get vaccinated, prevention is also important. And so for us, making sure that people have access to information and appropriate PPE is another component, right, to keeping everyone safe. And so when we have stakeholders and partners like Blue Cross Blue Shield in our relationships with Interfaith, we're able to reach into communities and really say, this is what we can all do to do our part and make sure that we stay safe. And I think for the United Way, this has been a great initiative to just be a part of and have the support of folks like Cheryl and the people like Can to really lead that work.
Well, I think what is inspiring me through all of this is the fact that our funders are listening. And as we see the needs change and we share with them that the needs are changing, they're unrestricting those funds and evolving with us. And that's fantastic. So I know many of us are getting COVID fatigue, and we are so anxious to get back to normal. If we look at some of the stats, things are moving in a positive direction in the sense that at the time we pulled it, more than 47% of our community had been vaccinated or partially vaccinated. We see that the state is making a concerted effort to, bridge some of those inequities we were seeing in the communities of color. Yet some of the stats aren't quite as exciting. We see that COVID is still occurring at a rate of 1,700 cases a day. We're losing 15 to 30 people to COVID deaths a day. So what would you say to those of us who are anxious to get back to normal? And what does normal mean based on what we've learned over the course of the last year? Ron, let me go to you first and see what you think.
Well, it's certainly going to be a new normal that we're going to settle into. And I love how, Cheryl put it, it's the conversations, is how we really began to address our own community need was by our donors, our partners, our community members, our community leaders, our nonprofit leaders, all coming together and saying, let's talk. What is it that we need? What is it that we can do? Here is what I can do. Here is what I'm bringing to the table. And everyone brought what they were efficient at to the table. So whether that was just volunteering their time, whether that was just their organization or their corporate giving capacity, They brought it to the table and said, here is what we can do. And now that we're listening and now that we're at the table, this is the time that we're continuing those conversations about what's next. So regardless of where we're going to settle in the new norm, how do we prepare for what's next? And those are the conversations that are starting to happen right now. So when we think about come September, unemployment is going to stop. There's going to be a time where the utilities companies are going to ask for the funds that they were extending and not holding penalties for over the past year. And not all of our community members are prepared for that time. So we're going to see, this lasting effect for quite some time. And so what we don't want to do is like, after a hurricane or a storm that you can see, the rain is gone, the water's receded, houses are being rebuilt, everything's back to normal. So I don't want us to look at the vaccine is out, the majority of the public have it, everyone is outdoors again, so the disaster is gone. Many of our families didn't get into this overnight, so the recovery process is not going to happen overnight. This work and the support is going to be needed, and it's going to look different than it did in previous years, because we understand now what those barriers look like. We understand those systemic issues that we're going to have to address, and it's going to take more than just us. Everyone is going to have to do their part, from our corporate donors and sponsors, the nonprofits working more collectively together, our elected officials doing their part to ensure that these systemic barriers that have been put in place are removed so that individuals can sustain themselves on a pathway to self-sufficiency.
So Allison, I'm going to come to you next, but I'm going to close out Ron with, when you think about the services you provide, any big aha moments over the course of the last year that says, I got to do this differently, or this has to change?
A lot. I think one of the biggest aha moments is, one size doesn't fit all. We can have a backpack program, and this backpack program is huge. But in every community, that backpack program looks different. That was the aha moment for us, and saying, you know what, we really have to take this down to another level, and we really have to look at tailoring this a little bit differently. And how do we do that? And how do we scale that up?
I think we all had those aha moments like that. Just a couple of minutes left. So Allison, before we get into Q&A, Allison, let me get your perspective.
There's great South African.
So Allison, on my side, I've got a bandwidth issue. Hope others can hear.
I think it's a bad connection.
That says to volunteer is to give of yourself in service to a cause. And I think, that's something that really drives me in my work, is how can I be of service to show support through being involved in their. Can you hear me now? Can you hear me now?
Yeah,
to show support. I would just encourage folks to continue to show support through getting involved in their communities in various ways, right? Whether you're able to donate your time or talent or treasure, that is one way you can continue to engage yourself in this new norm, right? It's how can you be of service to others within the community? And I think, as we address a lot of this systems levels work, there's a role for everyone within that. And so how can you be of good service to your neighbor and to your community as we all continue to recover from the pandemic? I think that's one way that everyone can do their part.
I agree. I'm a big believer that we share our blessings, and I hope others will as well. Cheryl, anything to close us out before we go to Q&A?
Now, I keep backing up on Ron because my CEO always talks about it's the coalition of the willing, right? And so this work doesn't stop. And so I totally agree with Ron, these COVID task force that everyone has at their company and everyone's meeting about, it doesn't stop. It now changes its name to COVID recovery. And it's going to take us 5 to 10 years to get out of this. So people should just plan on, hey, this is a goal. And what is our, what is our flagpole at the end? But I will say it's going to take a coalition to continue to work. And I am hoping that the funding does not dry up for our nonprofits, because I know that you guys need this money more than ever right now. You are serving more people. And when I think about Ride United isn't just about vaccines. When we're done with vaccines, it's about getting people to jobs. It's about getting people to doctor's appointments. So let's not just bubble things in this COVID, but let's make sure that we have a long-term strategy around the work that we're doing now.
I absolutely love that. Coalition of the Willing. Thank you for closing us out. Let's open it up to Q&A and let's get the dialogue going. So Devin?
We don't have any questions submitted yet, but folks, if you do have questions, please drop it into the Q&A portion. And I can also, if we want to keep this conversation going a little bit, I can also raise my hand or say something if questions do come in. So totally up to you guys. I've really been enjoying the conversation so far.
Very good. Well, while we wait for a question or two to come in, anybody have anything else that you think is pertinent that we didn't address so far in our conversation?
Well, while we're here, I just want to kind of say thank you. If there's no other topics, then one thing I didn't address is to say thank you. So thank you for the opportunity to allow me to thank you on behalf of all of the thousands of families that have come through our doors, through all of the partners' doors that United Way supports. Thank you on behalf of them and on behalf of those clients. Many of those families, thousands of those families, you may never see. You may be walking through the mall or going through the grocery store one day, and you pass somebody that once depended on the services that were provided today, who are now able to walk through that grocery store, who are now able to walk through that mall and find something because they're working again. We never know the impact and the reach we have by doing our part today. So know that you've done your part today. And as you continue to do your part, the more people you will continue to touch. So thank you all for your support and all that you do to help us eliminate poverty within our community.
Very good. Devin, any Q&A?
Yes, we have 3 questions that have come in. So the first one is, can you share more about the health literacy element with Ride United NC?
Cheryl, is that something you can speak to? Or Allison?
I can tackle it. I haven't been working on that piece. I don't know if Devin or Addie has more.
Absolutely.
Yep. I don't know if Allison is frozen. I can pick it up really quickly. So the health literacy element, there have been 2 major barriers for accessing the COVID-19 vaccine for underserved communities. So Ride United NC is specifically supporting low-income communities, seniors, the unbanked, uninsured, and communities of color. And so those 2 barriers have been transportation access and education around the vaccine itself. And so Ride United NC is really trying to tackle both of those at the same time. So one portion is the transportation access. We're working directly with Lyft and the North Carolina Department of Transportation in order to provide pre-scheduled rides for people who have vaccine appointments already. The second element are health literacy sessions that we will be conducting over a regular period of time, beginning in May. I believe that information will be published on our website as soon as it's ready. But we've partnered with Pillar Consulting, which was founded by epidemiologist Dr. Bobby Banks, who is local to the Triangle. And she and her team will be putting together these sessions, all virtual, designed to educate folks about the vaccine so that they can make educated decisions about their own vaccine uptake. So again, that information will be shared on unitedwaytriangle.org/RideUnitedNC and on social media. So if you do have questions about the vaccine, if you know anybody who is maybe a little hesitant, like please feel free to share those links And the more we can educate the community, the faster we can get to a herd immunity, the faster we can go back to whatever normal is going to look like.
Thank you. How about our next question?
Yes, the next question is, what role did the PPP plan from the national level help? How did the PPP plan from the national level help your organization? And how do you view this going forward as an option for nonprofits?
So Ron, did you have opportunity to use the PPP?
Yeah, and I can tell you that with that option there, we actually were fortunate with our donors. Blue Cross Blue Shield was one of the first ones that actually came to the table when this all began in Food Line Feeds. And so we did not have to necessarily apply directly for any type of funds this way. However, the reimbursement process for our staff was beneficial for us when individuals were exposed and they had to be quarantined. So we were able to ensure that those individuals were able to continue to take care of their families without pay. So there was those types of benefits that were there. But just in talking to some of our partners with some of our local restaurants that mentioned it and talked to us about it, it was a great assistance for them that supplemented. And many of them we were able to invest with the resources that we were giving locally in partnership with many of the local restaurants to help keep them going by purchasing meals from these restaurants and allowing them to actually deliver those meals directly to the local community. So it was a win-win that they were able to maximize the PPP and then utilize the partnership that we have with them to keep their employees going.
Yeah, I know for some of the other nonprofits that I support, they found it of great assistance as well, because it came at a time when they couldn't hold some of their biggest fundraisers. And this really helped to supplement some of that income and revenue loss that they saw. So tremendous assistance. Thank you. Anyone else have anything to add? Okay, I think we had another question, Devin.
Yep. And we just had another one come in too. So as long as you guys want to do this until we hit 1250 or so, we can keep going. The next question is, what communities across our state, region, and country do you see doing interesting / exceptional work during this time?
Right here.
Yeah, I'm with Ron. I have to say, if you guys are following the state, I mean, I think we're the only state that's actually collecting the racial data, to be able to know like who's getting it, what counties. I mean, we are definitely a poster child for what is happening around this pandemic. And I give kudos to Secretary Cohen and, Governor Cooper around that, the efforts that they have put across this. But I think North Carolina is who people are looking at, and we should be proud of the work that we're doing here in the state.
Great, thank you. Anybody else want to add to that?
No, I echo Cheryl's sentiments. I think the work that's happening right here in the Triangle really speaks volumes. And the way we've been able to respond just to the need and allow our community partners and our constituents, as well as our corporate partners, to really drive those efforts. It's really something that you can see. It's visible. You can feel it when you talk to people. They feel the support. And I think that for us at the United Way, that's really what matters and what counts.
Very good.
Love it.
All right. Go ahead.
All right, so last question for right now, unless anybody else pipes up. So for Interfaith Food Shuttle, have your relationships with food sources like grocery stores or restaurants been enhanced or strengthened in any manner?
It has definitely been strengthened on so many different levels. And we are rebuilding those relationships with those restaurants, those grocery partners now. When it's initially first started, donations that we were receiving, food recovery, actually fell off because restaurants actually weren't having, grocery stores didn't have access to their normal supply of products. So therefore, the waste was very little. So our food recovery dropped off tremendously. However, our partnerships with those grocers strengthened. Great example of that would be Food Line and their foundation with Food Line Feeds. So understanding that their retail partnerships were dwindling right now just because of their own access to food, they really ramped up their foundation giving to ensure that we were able to go out and purchase product and able to supplement what we were not getting from those retail stores. So it definitely strengthened, even if the actual day-to-day resources that we were getting on a normal basis weren't there, the partnership definitely strengthened.
And do you see that continuing as we adjust to this new normal that we see? It's not just a moment, but a movement?
Absolutely. They're transitioning, as the stores began to get back to those levels. They are continuing to stay engaged with the community. But as their employees are coming back online, they're not only bringing them back in the stores, but they're starting to reach back out to say, hey, listen, how can we get back in now and start volunteering? Where are the opportunities where we can give our employees an opportunity to get engaged? It's not so much as it's just as much as the corporations are saying we want to be engaged. The employees are saying, I want to give back. My community was there for me, and I want to be there for my community. So the partnership is definitely increasing and growing and strengthening. It's communities taking care of communities, and that's just been the way that we've been able to do it. So, it's never been about big government. They do their part. We bring in the resources, but we take those resources and we put them to work right here at home, because the organizations here, we know what to do. We know what our community needs, and communities continue to take care of communities.
Very good. Let me extend that point over to our United Way team. So, Allison or Devin, are you seeing a strengthening of partnerships because this crisis has been so different?
Absolutely. I think, people are realizing that we can really get more accomplished if we work together, and we use all of our expertise and our access and resources to really figure out how we can move the needle as it relates to impact and reach deep into communities that we oftentimes don't either, have as much access to, or we don't typically serve. And so the way in which our corporate partners, our community partners, our government constituents are all thinking about ways that we can use our resources to really meet the need and impact is something that has really shifted and sort of changed for really the better. And so I'm just excited to see the work that continues to happen over the year. And as we move into this recovery phase, Ron mentioned food access and figuring out the need. We're launching a new initiative entitled Food for Durham to continue to support the work here in community around food access and food insecurity, and making sure that there's families that don't go hungry. And so I think as we continue to move throughout the year, you'll see many different stakeholders really using all of their resources to be most impactful. And so that's always great for us as an organization to be a part of.
Very good. Thank you.
If I can just build on Allison's points. With the Rapid Response Fund, we had, lots of organizations that you've heard of applying for those funds, and lots of organizations that had never previously applied to United Way of the Greater Triangle. And I think through the Rapid Response Fund, through models like 10 to Watch, which is focused on up and coming nonprofit leaders that are people of color and women, we've seen in very statistically significant ways that BIPOC-led organizations, where we went from 25% of our overall portfolio moving to above 40% of our overall portfolio this year. And then also and also the applications nearly tripled. So there's a real, I think, trust building within the community. And it's because this United Way of the Greater Triangle, led by the likes of Allison and Devin, we're out there and letting people know that this is not a United Way that's restricted by the status quo. So we're looking for innovative answers, and we're looking for answers that come from the community. We're not coming with the answers ourselves.
So Eric, building on that, when you think about 10 to Watch and leadership development, leadership through crisis, is that a new element that becomes a part of the curriculum as we go forward?
Yeah, I mean, I think I've been I was impressed before this pandemic with the amount of intellectual, emotional, horsepower that exists within this community. And, you know, I think so often when we're talking about resources, we're talking about money. But the real strength of this community lies in its people, and you know, our ability as a philanthropy at United Way to lift up the voices of the folks that are on the front lines doing this work is the whole thing. This United Way does not define ourselves by the size of our campaign, but by the power of our platform, and that platform comes from community.
Thank you. Devin, any other questions before we toss it back to Eric to close out?
We have two more questions if we have time for them. We've got our nonprofit partners actually chiming in, which I love. So Ginger Young from Book Harvest said, first, more of an observation than a statement. We nonprofits have been blown away by the collaborative spirit of funders reaching out and asking us what we need. So affirming, it's so affirming at a fragile time. Also, as Cheryl shared, we can tell that the road out of this time will take years. How do we all sustain and continue to center the innovative spirit and teamwork amongst sectors 3 to 5 years out?
Cheryl, you want to go?
Yeah, I'll just say, you know, we talked about companies coming together. I think nonprofits have to come together. I would love to see nonprofits come together and put a hub, a wraparound service, right? And really start to work together. So we know that food's an issue, but we know education is an issue. We know that basic needs, you know, really coming together and just seeing like, how can you guys collaborate with each other and make it more acceptable for organizations or corporate partners to invest in you guys differently, right? From a partnership standpoint. I do think, you know, as much as I would love for the dollars to always be there, you know, again, these corporations, we've taken a hit. So, you know, the first thing that people look at is that community giving, right? Because you got to make revenue. So I hope that at the same time that we're investing, that we're going to start making smart investments. And those smart investments are going to be those organizations that are collaborating with other organizations so we can get the best outcomes from our dollars.
Thank you. And Ron, did you have something you wanted to add to that?
No, I was just going to say, I absolutely love that question, especially, you know, the innovative spirit in that. We're in the middle of this process right now. We're working with a great organization with Moss and Ross on our 5-year strategic initiative. And a part of that is addressing this question. And it's really identifying who we are as Interfaith Food Shuttle and what we give to this and provide, what services we provide to this community. Understanding the needs, we can't meet them all. So we don't try to address them all. We try to do what we do best. And a part of what we do best is working with other organizations who do what they do best. And so we find ourselves writing other organizations into our strategic plan so that we can hold ourselves accountable to working and partnering with them as well. Right now, Central and Eastern Food Bank as well is working on their strategic plan. And that's the commitment that we made to each other, not to duplicate services, but to expand the services and expand our reach by partnering together and doing what we both do best. And we're expanding that with so many other local nonprofit organizations, whether they are doing food distributions or doing furniture distributions. All of it is empowering our community, and there is a way that we can work together.
I love the power and the spirit of partnership. Thank you for that. Devin, let's squeeze in that last question before we toss it back to Eric. Okay, I thought we had one last question. There we go.
Oh, okay, sorry. You broke up for a second, so I was trying to figure out what was happening. So the last question is, what is the greatest issue we still face as the pandemic continues? And this comes from our partner at Urban Ministries of Wake County.
So we heard consistency of funding, making sure that doesn't dry up. Any other things that anyone want to throw in? Go ahead. Allison?
I would say, again, going back to the vaccinations that are happening, and the governor even rolling back some of those restrictions as it relates to public gathering. We still need to keep in mind that we are living through a pandemic, and so that prevention piece and ensuring that communities have access to the proper PPE and information, as well as access to places that they can be vaccinated. I think that's something that continues to be key. And just wanting to remind the community that we can't get too comfortable just yet. We still need to be vigilant around protecting ourselves, protecting our loved ones, but more so protecting our community. So when we do sort of go back to a new normal, we can really kind of lean on each other in our experiences and continue to allow our communities to thrive. And so I would encourage folks to just continue to support your communities, support your organizations, and figure out how you can be of great service.
What a wonderful way to close us out. My sincere thanks and appreciation to all of our panelists today for your wonderful words of wisdom. We look forward to working with you as we go forward. And with that, let me turn it back over to Eric to close us out.
Thanks, Joan, and thanks to all of our panelists. The thing that I don't want to lose sight of as we close here is we're talking about people. And there are 200,000 people that were suffering from the ravages of poverty before this pandemic. That's a Johnson administration metric. And what I was fond of saying, or what I was in the habit of saying 3-4 years ago, was that those 200,000 are one crisis away from, there's another 200,000 that are one crisis away. Well, that crisis has come. We now have close to 400,000 folks in the triangle that are in poverty, right? And there are still many, many more that are knocking on the door. And the majority of those folks are Black and brown folks. And that is because of 400 years of systemic oppression. Okay. So this is not just a 3-year pandemic. Look, I want to get off Zoom calls. I want to start going out to dinner. And I have tremendous privilege as a white man saying that. And what I would want to really emphasize as we close out here is that we have to get, as Allison was saying, really uncomfortable if we're going to make this new normal a new normal for everybody and not just a new normal for folks like me. So in the clearest possible terms, this is about people. This is about all of us. This is about the power of partnerships. And if we are going to be an anti-racist organization at United Way of the Greater Triangle and an anti-racist and an anti-poverty triangle, we have to be anti-racist and anti-poverty. Those things are not, that you cannot separate the two. So let's do it together. Let's do it across lines of difference. And I'm just so grateful for all of you for being here today, and go out and tell your friends and neighbors the good work that folks like Joan and Cheryl and Allison and Ron and so many of us in our community are doing for those 400,000 folks that are really hurting right now. Thank you.
Thank you, everyone.
Thank you.
Thank you.